But the people who are just logging in, name is Dr. Isang, cardiologist, using this platform to discuss things regarding the heart, health, and prevention. And the biggest reason regarding this is that prevention is a lot better than treatment. If you understand what the risk factors are for heart disease, if you understand what the risk factors are for a stroke, and if you treat those risk factors appropriately, you can potentially prevent a stroke, prevent a heart attack from happening. So things like high blood pressure, um, diabetes, high cholesterol, smoking, strong family history, all of those play a huge part in prevention. All of those plays a huge part in doing what you need to do to prevent a heart attack from happening. So, just using this platform to answer those questions, using this platform to discuss those topics because it's extremely important. You're talking about saving someone's life. You're talking about preventing significant financial burden to somebody. So this is just a platform to be able to discuss that. Your fellow bookworm, I appreciate that. If you have any questions regarding the heart, regarding health, you just let me know and I'll do my best to answer it. There's always going to be somebody negative saying things, so I don't pay them any mind. Sometimes I block them. Sometimes I do have a question. Are there different parts to the heart, or is it just one big section? So there are different. I hope the fan isn't too loud, but there are different sections of the heart. You have the top chambers and the bottom chambers, and there are two of them. So you have the atrium is the top chamber, and the ventricles are the bottom chamber. Yeah, so you have the right chamber. I mean, you have the right atrium, right ventricle, left atrium, left ventricle, and they all work together in helping blood flow appropriately. The left side takes blood to the body, to the brain, to the legs, everywhere, back to the heart itself. And the right side takes blood to the lungs to get oxygen. That's right atrial and right ventricle. So that's LVH. You're welcome. Thank you. Thank you. That was a good question. Thank you. Thank you for even coming on. I'm gonna keep on doing this until I can build up the brand. So I appreciate you for taking your time, even a few minutes. Inferior, probably acute. Mm, yeah. All right. So, uh, like I said, my name is Dr. Easting, and I use this platform to discuss things regarding the heart health and prevention. And the reason behind it is that prevention is a lot better than treatment. So, if you understand what these risk factors are for things like heart attacks, strokes, you can potentially prevent it from happening or delay it significantly. Some people do have underlying genetic things that you cannot change that can lead to you having an unfortunate event. I've seen people have a heart attack as young as age 2. So you have to take all of this in, you know, all at one piece, and also realize that there are some things that you can change and there's some things that you cannot change, such as genetics. So what can you change? Your weight, by exercise, by watching your nutrition, blood pressure, by exercise, nutrition, and if needed, medications, cholesterol, diabetes. All of those are the same. So a lot of times people don't know that they have these risk factors because they haven't had it checked. So it's important to follow up with your medical provider, at least on an annual basis, to get that checked appropriately to make sure that you're not at risk of having a heart attack or of having heart failure. So just making sure that you follow up with your medical providers on a routinely basis. And I think people start to do a lot better. Unfortunately, people don't. So we we have an epidemic of diseases, heart disease, heart failure. So I just use this platform to be able to answer those questions, to be able to help people who have questions regarding their heart and regarding their health. I'm just going to give it a little bit more time to see if anybody has any questions that they want to be answered regarding their heart and regarding their health. And if not, I hope you guys have a great Thursday leading on into the weekend. For those of you guys coming in, my name is Dr. Isang, using this platform to be able to discuss things regarding the heart and regarding your health, and just being able to answer any questions you guys may have. All right, I'm about to head off. So if anybody has any further questions regarding your heart, regarding your health, let me know. What is a typical schedule on a normal day compared to a busy day? I appreciate that. On a normal day, I'm basically 9 to 4, sometimes 9 to 5. My typical day is outpatient, where I start seeing patients at 8:30 to 9. Between that, one of those, usually 9, but I occasionally will schedule an 8:30 if I need to get them seen a little bit earlier. So between 8:30 and 4:30, I'll see anywhere from as little as 14 to 15 patients, upwards to 17 to 20 patients. It just depends which day it is. My Wednesdays is my new patient days, so those ones are typically less. It's probably 12 to 13 because they're all new patients. So I dedicate anywhere from 30 to 45 minutes for each patient. And that basically goes on each and every day. Things that can tweak it up a little bit is whether I'm the echo reader of the day, where I read echocardiograms for the whole hospital, or I'm the stress test reader, which I'm going to be doing tomorrow, or if I'm doing procedures in the hospital, the less invasive procedures such as TEEs, or I put a probe down someone's mouth to look for any clots in the heart, assess the heart to make sure the heart's functioning appropriately. But then when I switch to my inpatient days, which I do about 1 week every month, those can be pretty crazy because it's basically 6 to 6, um, 6 a.m. to 6 p.m. And that 6 p.m. is, in quotation marks, because if someone is extremely sick, you probably need to stay a little bit longer to take care of them and make sure that they're doing okay. So, um, and then half of those days on my inpatient days, I'm taking night calls. So you're basically available for 24 hours to help and assist. Because I'm a non-invasive cardiologist, I don't do heart caths or put in stents or anything. So not as crazy a schedule as my interventional colleagues, because they have to answer for STEMIs and people having acute heart attacks. Oh, you're welcome. Are you interested in going into medicine, or are you already in medicine? Hopefully one day turn up. Let's go. Definitely asking the right questions. The biggest thing is also understanding what the lifestyle is. Not all careers in medicine are created equally. Some people have jobs that are a little bit more hectic. Um, some people have jobs that have a little bit of a better lifestyle. So the biggest thing is going to be choosing a job that has um, a little bit of both, but also understanding that if you choose a job that has a crazy lifestyle, you have to be okay with what that means. Um, some of my colleagues are extremely busy in other fields such as surgery, so time away from home and family is pretty big for them. So other of my friends do a lot of outpatient and um, do like 4 days a week, so they have a better lifestyle with that. So just making the decision for the right reasons is going to be the biggest thing. Any tips on working during medical school? You don't. You don't work during medical school. The people who tried to work during medical school, at least when I was in medical school, they all failed out. So ideally, you don't work during medical school. Unfortunately, a lot of people take out huge loans to be able to survive during medical school, but working during medical school is almost non-existent. I've seen some people nowadays because of social media that you can do things that way, but having a physical job in addition to medical school is almost impossible. Once again, no. Um, Not many people were able to. You can try. I mean, is it illegal to work during medical school? Absolutely not. But more than likely, if you try to work during medical school, you will fail, especially your first 2 years. Heart palpitations and X-rays typically are two separate things. Sir, my heart beats super fast and I feel short of breath and dizzy after I squat. I am new to the gym. Please review. So, I think a lot of that is just, you know, depending on how old you are and things like that. Usually, if I have my patients are a little bit different because they are cardiac patients, but when they're starting a new exercise regimen, I typically do like a treadmill stress test to see how they function. It could be deconditioning, just haven't been working out for a while, but if it's happening persistently, I would definitely follow up with your medical provider just to make sure that something else isn't causing the symptoms that you're having and that you're feeling. Excuse me. Can arteries that are clogged due to cholesterol be reversed or unclogged? And short answer is yes, but it also depends on how long it's been going on for. So um, we can put in stents, and what stents is, it actually goes through that artery that's clogged and opens it up as long as there's blood flow in that area. There are some medical therapies to bring down that cholesterol. There, the newer therapies actually bring the cholesterol, the bad cholesterol, significantly lower to like less than 50. And we found that when that cholesterol is less than 50, it can actually have effects of reducing that plaque burden, that cholesterol. Cholesterol typically builds up in the arteries, less likely in the veins. But if someone is having clogged veins, then you may want to see a vascular surgeon, because a clot in the vein, also needs to be treated, because those clots can go into the lungs and cause blood clots in the lungs, and what we call pulmonary embolism. I'm gonna call this the left bundle, but it's the right axis. Oh. You're welcome. You're welcome. You're welcome. Welcome. You call this Mobius 1. Did I call it a first degree AV block too? All right, I'm gonna give it about 2 more minutes again, and if no further questions, I will hop off of here. Hope you guys are having a good evening. Mm. Does the heart lose its ability to beat if a person has a stagnant desk job for multiple years and suddenly they start to work out? Wouldn't say it loses its ability to beat. You just become deconditioned, and For those individuals, you want to start them slowly back on a workout regimen. You don't want to go running marathons on day one, but start slowly walking and then walking longer distances, faster paces, maybe walking on a treadmill at an incline. Uh, that question isn't, straightforward because some people can have a desk job and don't have any underlying heart issues. And for those individuals, if they go back to working out over time, it'll get better, it'll get stronger. There are some people who have a stagnant job, but then over time they have developed significant heart issues, and when they try to go back to working out, they can't because the damage has already been done. So now you're looking at how to improve that damage and get back to having a better quality of life. You're welcome. You're welcome. I appreciate the subscription too. Slowly but surely, I'm going to work my way up. Posterolateral.